Ms. Ong, good afternoon. Let me provide you with some instructions which I give to every witness in every case. The first is to please sit back and relax. The second of which is to speak in a loud voice, and that way everyone can hear you. The third is if you are called upon to provide a yes or no answer, please use yes or no rather than slang or which can be confusing. And the last is to please wait until you hear an entire question before responding. Many of us every day think we know an answer to a question, so we interrupt it. But in a court, it's important to just have the entire question asked first and then the response thereafter. Is that okay?
Yes, sir.
Thank you. Ms. Brazil, direct exam.
Thank you, Your Honor.
You're welcome.
Good afternoon, Ms. Ung.
Good afternoon.
Do you recognize the defendant, Conrad Murray, seated here in court today?
Yes.
May the record reflect she's indicating the defendant.
Yes, please.
Ms. Ung, when did you meet the defendant?
I met him sometime 2000. I don't really remember the date, but I met him through my grandmother.
Was it around 2003, 2004?
Somewhere on the date.
And was the defendant treating your grandmother?
Yes, ma'am.
After the defendant treated your grandmother, did he improve her health and help save her life?
He did.
And did you then begin to work in his office?
Yes.
Describe how that came about, please.
Well, I asked him if I could volunteer in his office, and he said that's okay.
Were you also working someplace else?
Yes.
Where was that?
In a group home.
Were you acting as an attendant at the group home?
A caregiver.
Are you a registered nurse?
No, ma'am.
Are you a licensed vocational nurse?
No.
I'd like to fast forward now to June of 2009. Had you been working in Dr. Murray's office, actually volunteering in Dr. Murray's office for a period of time?
Yes.
As of June?
Yes, ma'am.
Had you volunteered fairly consistently from 2005 until 2009?
Yes.
How many days per week on average were you volunteering in June of 2009?
I would be there like 5 days a week.
Describe for us what type of duties you performed in Dr. Murray's office.
I kind of help in filing. I answer phones. I help in the front too. I help in the back too. So,
when you say you help in the back, describe for me what you would do.
like I would triage patients when needed, meaning taking vitals, blood pressure, pulse rate.
This was in Dr. Murray's Las Vegas office, correct?
Yes, ma'am.
And where was that office physically located? What street?
On Flamingo.
Would you describe the office layout briefly? For example, how many examination rooms?
There are like 4 exam rooms, 2 rooms he uses for patients, 1 room, there's an extra room, another room that we have where we have the ECP machines, and then there were 2 offices in the back, a break room, the front office, waiting areas for the patients, and then we have another like 2 more rooms on the other side, and a bathroom.
And you said the ECP room. Is that a specialized room where patients come in for therapy to assist them in their recovery after procedures performed by Dr. Murray?
Yes, ma'am.
Do you know a patient, Robert Russell?
Yes.
Is he one of the patients who used the ECP room that you've described for us?
Yes, ma'am.
Now, besides yourself, who else worked in Dr. Murray's Las Vegas office?
There were 3 other girls. One is Carol, Sarah, and Leah.
You've told us what type of jobs you perform. Tell me what type of duties that Carol performed in the office.
Well, everybody's cross-trained, but Carol mostly handles the front. But if needed, she covers in the back too. because everybody's like does everything.
And what are the front office duties? What would you characterize them to be?
It's like checking in patients, answering the phones, scheduling patients, then getting authorizations and verifying insurances.
Authorizations, referring
For-
to insurance
like-
authorizations?
Yes,
And what was the last thing you said regarding insurance?
a verification of insurances.
What's the average age of the patient population at Dr. Murray's Las Vegas office?
Sustained.
Did Dr. Murray's office treat specifically and exclusively heart problems?
Yes.
Describe for me, please, what Miss Tanner or Leah did in the office.
Leah does back office too. She answers calls, files, help in the front if needed.
What about Sarah?
The same thing.
Same thing? Mm-hmm. Is that yes?
Yes, I'm sorry. Yes.
Is Carol a registered nurse?
No.
Is Leah a registered nurse?
No.
How about Sarah?
No.
Is Carol a licensed vocational nurse?
No.
Is Leah a licensed vocational nurse?
No.
Is Sarah a licensed vocational nurse?
No.
So all of you basically did anything that needed to be done in the office. Is that
Yes.
accurate?
Yes.
Was there someone outside of the office setting in Las Vegas who handled other aspects of the office work?
We have an assistant administrator.
And who is the assistant administrator?
That's Miss Stacy.
And where did Miss Stacy work out of?
She's based in San Diego.
What type of duties did Miss Stacy handle?
Mostly administrative.
And could you describe what that would be?
Like office ordering of supplies. If we need anything, she handles that. She also does like payroll. No, she doesn't do the payroll, but she processes it, like submit it to the payroll service and Dr. Murray's credentialing. Mostly administrative.
So would you, ladies in the office, be in contact with Miss Stacy if you needed something?
Yes.
Describe the office hours that were kept in Las Vegas, please, during the the entire year of 2009. On what schedule would you see patients?
Like every other week, Dr. Murray's in Las Vegas, and then the following week he'll be in Houston.
So basically, Dr. Murray's schedule alternated 1 week in Houston and 1 week in Las Vegas, correct?
Yes.
Was your office in Las Vegas open when Dr. Murray was practicing in Houston?
Yes.
Did you see patients in Las Vegas when Dr. Murray was not there?
For some procedures,
What types of procedures?
like an echocardiogram and the ECP.
Who would perform the echocardiogram procedures during the times that Dr. Murray was not in the Las Vegas office?
An echo tech that comes in when we have procedures.
So someone from the outside would actually come in, sort of set up shop in the doctor's office, perform the echocardiograms,
Yes.
and then provide you ladies with the information?
Yes.
And the ECP therapy, that would be conducted in Dr. Murray's absence by any one of you ladies, you, Leah, Carol, or Sarah?
Yes.
And what did that consist of? What did you need to do to help someone who came in for ECP therapy?
Like, you mean the procedure, how we do it?
Yes.
Okay. We wrap the lower extremities. We put the patient on blood pressure cuff and check the oxygen level too. And then we hook up the patient on the machine.
Describe for me how you check the oxygen level.
We have a machine that we use to check the oxygen level, an oximeter machine.
And how would you connect that oxygen machine to the patient to check
The finger.
So you'd stick an object on the patient's finger and you would have some sort of reading about their oxygen?
Yes.
And then what would you do with that information?
We just log it, put it in the computer.
And you would do the same with checking the blood pressure of the patient?
Yes.
During the course of their therapy, how many times would you perform those checks?
Objections or relevance at this point?
I don't
Sustained.
remember.
The partial answer is disregard. Thank you.
When Dr. Murray was not in the office in Las Vegas, did he have contact with any of you?
He would call the office.
And who would he typically speak to when he called the office?
Anybody that picks up the phone.
Would he call on a daily basis when he was away?
Yes.
When Dr. Murray was in Las Vegas, did you see patients on a full day or partial day basis?
Partial day basis.
Did Dr. Murray perform procedures in his Las Vegas office?
No.
Were his patients treated for their procedures at a local hospital?
Yes.
And when were those procedures scheduled? Afternoon, morning?
When he's not seeing patients, usually on a Friday, he does procedures the whole day. And when he's not in the office, he usually does his rounds and other procedures during the hospital.
Ms. Ung, in June of 2009, did you know that Dr. Murray was spending time in California?
No.
When Dr. Murray was out of your office in Las Vegas, did you know where he was located?
No.
In June of 2009, did Dr. Murray direct you to cancel some patients' appointments?
What specific? Are you talking about a specific day or?
Not specific. I'm asking you to think back in the months of June. Did Dr. Murray instruct you or anyone else at your staff to cancel some appointments?
There were times that he would call and say to reschedule patients.
Are you familiar with the letter that was sent out from your office around June 15th of 2009 informing Dr. Murray's patients that he would be leaving his practice for a period of time?
Yes.
Ms. Ung, can you see the letter that's up on the screen?
Yes.
Do you recognize that letter? Is
Yes.
that the letter that was sent out from Dr. Murray's office informing his patients of his upcoming sabbatical? Can you see it?
Yes, I can see it.
Is that the same letter that was sent out from your office?
Yes.
Did Dr. Murray tell you that he was going to be leaving the office in Las Vegas and traveling to Europe?
Yes, he told us that he will be traveling on a tour and he will be leaving the office.
Did you know that Dr. Murray was the personal physician for Michael Jackson?
We were told.
And who told you that?
Dr. Murray?